the shedding of your lining is only supposed to be the 3 to 5 tablespoons of bleeding.
So there are lots of symptoms that can be attributed to fibroids. The most common symptom that we see is heavy or abnormal uterine bleeding or heavy periods, soaking through clothes. It is the most common, but some of the other less common symptoms can be constipation, urinary frequency, pain is a big one. Your abdomen growing, even though you're skinny like Coach Jessie, you can have like just a kind of a protrusion that you think is bloating at a certain time of the month, but then it does start not going away.
Yeah. I think a key thing there, I'm glad you brought that up, the irregular cycles, Dr. Tiffany, because the National Institute of Health has reported that the shedding of your lining is only supposed to be the 3 to 5 tablespoons of bleeding. Now, every time I say this, women are like, nah, that's never been my case. You know what I mean? But I see when women, in our practice, when women have reversed the estrogen in their nutrition plans and the stress management, we see them have the 3 to 5 day period where it's just light bleeding and spotting. Okay. And
I call it the cute period.
Yes. We call it the happy period, right? Where it's like no cramp. It comes and goes like, oh, I got my period. Oh my goodness. It didn't like, oh, my period's coming. I know this because my breasts are tender or I'm getting the cramping. And that's critical because we can stop it. This is the prevention piece. I want our women to understand, wait, this is a sign. And really, that is really our body screaming something is wrong.
I want to highlight just a few others. So some patients have discharge. And don't realize that their discharge might be actually from their fibroids. They think maybe they're urinating on themselves, but it doesn't smell like urine, doesn't have an odor to it. Sometimes that's just the fibroids. Or they just have, more nighttime awakeness. They wake up at night or leak urine in the morning. And sometimes that's just from the fibroids pressing on. Sometimes the symptoms are very subtle, and sometimes they have no symptoms at all. I have seen some of the largest fibroids that can be what we call pedunculated fibroids that are 22 centimeters sitting in the upper abdomen, and the woman might not even know it's there. So that's why the symptoms have to go along with a very much awareness that you have of your body and the dynamic changes that it's making, and also getting your exams, going to the doctor and having that other person that's able to do exams and from year to year say your uterus is growing, or it's not a normal size, or there's something that's a little bit different, or that odd symptom that you gave me may be presenting, as a subtle sign of something else that's going on with your body. So the symptoms are not always obvious for fibroids.
Dr. Sohini, one I forgot to mention is infertility. That was actually mine, that I was unable to conceive. That's how I found out I had fibroids. And pain during intercourse. That sometimes it may not be cycle pain, but it may be because where it's located, it's actually obstructing.